So, good morning, everyone, and welcome to our webinar on IHI Call number 1, topic 3. That's on personalized oncology, innovative people-centered multimodal therapies against cancer. So today, as you can see, Usama Karoom's going to take over in a moment. He's going to give the presentation. We have Desmond. I don't know if we have any other people from the legal team at the moment. No, so there's Desmond. We have the legal team with us, the comms team. I have Catherine and myself. And just a few things before we start and you go into the main show. We are going to be recording this webinar. It's going to be published on the website. Anyone that gave permission as well, we're going to give the participant list so you're better able to network. So you can check out the presentation slides, and the participant list on the webinar page very soon. And I think if any of you have done any other webinars, you know that we repeat this because it is important, is that all information regarding future call topics, including these, right, is indicative. It's subject to change, so final information about future IHI calls will be communicated after full approval by the governing board. So another thing that I've noticed in some of the questions that have come up is how to get in contact with people. And I do mention that the brokerage event, you can in fact still go, the brokerage event is done, but you can register and find people through the participant list. In fact, what I'll do is I'll share a link to that after I'm done talking. And all the videos and pitches will be up very shortly, perhaps in just a few hours. So on today's webinar, I think it's important that you know that it's not going to cover rules and procedures because we had a very long, very in-depth rules and procedures webinar, which you can go to and you can watch. You can see the slides. You can look over. If you have any other questions, just send an email to info-desk@ihi.europa.eu. And what is new, which you're probably aware of by now based on how many people are signing up, is preparing the proposal budgets. So the financial aspect of making a proposal is going to be a webinar on the 27th of June, so on Monday in the afternoon at 14:30. So you can ask questions anytime in the chat box. We will get to them. We'll ask them of Usama and Desmond. And I'll leave it over to our extremely knowledgeable scientific officer, Usama. It's all yours.
Thank you very much, Tom. Thank you for this introduction. Good morning, everyone, and welcome to this webinar on the first IHI call, and which will be focused on topic 3. So as said, Tom, I will not cover some aspects related to rules and procedures during this webinar. And what will be covered will be, so I will start with a short introduction on the IHI program, and then I will speak about the topic 3 itself, presenting the challenges, the need for public-private partnership, the scope, expected outcomes and impact. We'll also go through some important information around the proposal submission, the evaluation process, and I will give you some tips for the preparation of the proposal. So IHI, or the Innovative Health Initiative, is a European partnership for health between the European Union, which is represented by the European Commission, and a healthcare industry association, including COSIR with medical imaging, radiotherapy, electromedical industries, FPR, which includes Vaccine Europe for pharmaceutical and vaccine industry, EuropaBio for biotechnology industry, and MedTech Europe for the medical technology industry. So for those of you who are familiar with IMI, you can see that IHI is broader because it includes much more healthcare industry sectors. So what are the IHI general objectives? So our ultimate objective is to turn health research and innovation into real benefits for patients and society by delivering safe, effective health innovations that will cover the entire spectrum of care, from prevention to diagnosis and treatment, and this especially in areas when we have an unmet public health need. Another objective is also to make Europe's health industry more competitive globally. So we have a strategic research and innovation agenda, which we focuses on the cross-sectoral approach. to facilitate the creation of new products and services to prevent, intercept, diagnose, treat, and manage diseases. And our goal is to lay the foundations for the development of safer and more effective healthcare products and or solutions that respond to unmet public health needs. And of course, that can be implemented into healthcare systems. If you want more information about our strategic research and innovation agenda, I invite you to click on the link on this slide so that you have access to the entire to the document. So how does IHI work and what is a single stage procedure? Because for these topics, for the first call, topic 3, we will be following a single stage procedure. So the first step here is the call launch. So as it was said by Tom earlier, the call has not been launched yet, and it will be in the next few days. We don't still have the exact date, but it will be in June. And after the call launch, you will have access to the final topic text, because for the time being, the topic text which is available in our website is subject to change because it's a draft topic text. So please wait having the final topic text to really look at this document, which will serve as the reference documents for the evaluation. Then after the call launch, we expect applicants to form consortia. So each consortium will be formed by different partners coming from different sectors. You can see here some examples, so private partners, academics, SMEs, healthcare professionals, and so on. And each consortium will submit work and submit a proposal that needs to address all the objectives, expected outcomes, and expected impacts, which are mentioned in the call topic text, the final one. So there will be, of course, a deadline for the submission of the proposals. And once the deadline is passed, then we will enter into the evaluation phase. All the proposals will be evaluated in a competitive evaluation process by an independent panel of experts. And only the top ranked proposals will go to the granting phase, and only this proposal which will get the highest score will be launched as a project under IHI. So now we're going to talk about the topic itself, which is entitled Personalized Oncology, Innovative People-Centered Multimodal Therapies Against Cancer. So you all know that there are different treatment modalities which are available to treat various types of cancer, and also that multimodal therapies have been shown to be of high value, especially in the last 2 decades. And we also know that there is different biologies of cancer from one indication to another, or even from one patient to another in the same indication. And that the efficacy of treatment modalities are different, which show the need of a patient-specific approach. So there is here, the challenge is that there is a strong need to increase first the therapeutic arsenal of such multimodal therapies, but also to tailor the treatment approach to the individual patients. So we need, for achieving this, we need a cross-sectoral approach. So we need a public-private partnership, because the development of integrated healthcare solution, we think, can only be achieved if barriers to cross-sectoral collaboration is overcome. So we need patients to ensure people-centered approach. We need different industry sectors, and I mentioned the industry sectors which are involved in IHI, in health, to exchange knowledge and experience, and also to find optimal combinations of treatment and solutions. We also need academics and healthcare providers in order to leverage innovative clinical concepts, but also to make sure that the technical and scientific innovations has a clinical relevance. So what is the scope of the topic? So the aim of this call topic is biomarker-guided multimodal precision oncology. So proposals should facilitate the development of new technology and integrate them with current therapy concepts to create and explore multimodal therapies. Applicant consortia should pursue different therapeutic strategies and combine at least 2 cancer treatment modalities. please make sure that the choice you're making for the treatment modalities is supported by a sound scientific rationale in the application. Make sure also that the proposed activity should include the development of research protocols for multimodal therapies to be explored via early clinical studies, with, of course, sufficient sample size and statistical power to assess the safety, the efficacy, and to demonstrate the feasibility of the chosen multimodal approach. So some important aspects has to be considered, such as the clinical decision-making process aspects among the various disciplines involved, but also the evaluation of aspects such as the sequencing, the timing, and the dosing of therapies in order to maximize treatment effects and at the same time to minimize toxicity. So one key component of the proposals have to be the use of prognostic and predictive biomarker and the combinations of diagnostic tools in order to plan, adapt, and evaluate treatment. Proposals should also develop methodologies and standards for the combinations of various technologies into healthcare solutions, and should also build and develop the design and conduct of clinical studies of multimodal therapies and methods to evaluate their safety and clinical benefits. So what are the expected outcomes? So there are twofold. So the first one around platform, standard, and regulatory. So we expect a platform to be built for research and innovation collaborations across sector. We expect standard to be established in cancer healthcare pathway, but also we expect a demonstration of the benefits of health technology convergence. One also important outcome is the development and the improving multimodal therapies by development of health innovations in cancer therapy, through development, testing, and validation of multimodal therapeutic approaches supported by in vitro diagnostic in order to improve the active monitoring and adaptation of treatments through the patient journey. We also want a much more significant involvement of patients in the cancer patient journey. So for the expected impacts, we want to break down the fragmentations between the disciplines, the various disciplines of medicines and technological areas involved in cancer. We want to foster the development of safe and effective innovative health technology. So you can see that the expected impacts are closely related to the expected outcome. We want a better and faster integration of future products, vaccines, and services and tools, along the healthcare pathway to respond to patient-specific needs and patients benefit. We want the patients to benefit from treatment and care which will be better adapted to their needs via the improved diagnostic, prognostic, and monitoring their quality of life. And last but not least, we want to integrate healthcare solutions, including those which are based on the use of digital solutions. So for the budget and the duration, so for the budget, applicant consortia will be competing for a maximum IHI contribution of 40 million euros. We have estimated that an IHI contribution of around 10 to 20 million should allow a proposal to address the outcomes appropriately as laid out in the call topic text, which means that we expect at least 2 proposals to be granted following this evaluation. So one important aspect, and this is something that has been covered in the webinar for rules and procedures, that you have access to the recording in our website, as said Tom earlier, but also it will also be the focus of the next budget webinar, which will be held next Monday. You have to make sure, and I cannot stress that enough, that at least 45% of the action eligible cost has to be provided by an in-kind contribution from industry members and or contributing partners. As regard to the duration of the future project, applicants should propose a project duration that corresponds, that makes sure to ensure that the project activities expected outcome and impact could be reached within this proposed duration. So we've put here a table with example of budget. You can see here in this, and I repeat, this is example. You don't have to stick to these figures. It's just an example to illustrate the 45% in-kind contribution rule. You can see here that in this example, we have a proposal with a total cost of 40 million. Among these 40 million, 20 million will be requested as IHI funding, and 20 million will be provided as an in-kind contribution from private members and contributing partners. And you can see that in this instance, in this example, the in-kind contribution reaches 50% of the total cost, which means that this proposal in this case would be eligible. But I mean, this is an example. 45% would be sufficient as well. This is the minimum required, 45%. So it's really important that in your proposal, you describe the activities that are planned in relation to dissemination, exploitation, and communication. And also that you describe the target groups that will be targeted, and that you put aside sufficient resources for carrying out these activities. Because we think that these aspects are key to ensure a long-term impact of the project that will be launched after the funding ends. So what about proposal submission and evaluation aspects? So the proposal template is divided into 3 parts. So part A of the proposals, which is only administrative data. These data are entered in web forms in the funding and tenders portal. The second part of the proposal template is part B. It's the narrative part, which is divided into 3 sections, which are excellence, impact, and quality and efficiency of the implementation. So it's really important because you can see that these 3 sections of part B are the same as the evaluation criteria that I will speak about later on during this presentation. So please make sure that you read the instruction in the proposal template very carefully in order to ensure that you provide all the information which is required to ensure proper evaluation of your proposal. The third part of the proposal template are the annexes. So you have the participant type, the budget details, and an important aspect here, it's because it's expected in this topic to have clinical studies conducted, is that you have to complete the clinical studies template as part of the annexes. So the next slide. Okay, so these are the evaluation criteria, which, as I said, mirror the third section of part B, which is the narrative part of the proposal template. So I'm not going to go into details about each of the sub-criterion. I'm going to mention the 3 criterion, which are excellence, impact, and quality and efficiency of the implementation. You can see that there are sub-criterion. For instance, excellence, you have clarity and pertinence of the project objectives and so on. Impact, credibility of the pathways, and so on. And quality and efficiency of the implementation. This is something which is covered in the rules and procedures, is that webinar is that here, to be successful, proposal should at least reach a threshold of 3 out of 5 points for each of the criteria. So 3 out of 5 for excellence, 3 out of 5 for impact, and the same score, 3 out of 5 for quality and efficiency of the implementation. And there is also an overall threshold of 10 out of 15. So some tips for applicants. And so this is really obvious things, but we have really to say that, because we have to stress, we cannot stress that enough, is that the topic text will be the reference document for the evaluation. So please make sure that you carefully read and address all the objectives, expected outcomes, and expected impacts which are mentioned in the topic text. And also, as I said earlier during the webinar, please make sure that you refer to the final topic text that will be published in a few days. Another advice, recommendation is to form your consortium as early as possible, and you can already start forming it. Think about the fact that we are in a model which is a public-private partnership, meaning also that you have to include partners which bring in-kind contributions if you want your proposal to be eligible for the evaluation, because as I said, you have to bring at least 45% of the total eligible costs as an in-kind contribution. Please make sure, I already said that all information requested in the call text and the proposal template is provided in order to make sure that the panel of experts during the evaluation can properly assess your proposal against the evaluation criteria that I just mentioned. You also have to consider and plan for a potential regulatory impact of your results. So how to find project partners? So this is something which comes up quite often, this question, in order to build or join a consortium. So the first recommendation here is to use your own network, your own contacts. And as said, Tom, also earlier, we will publish a list of the participants of this webinar. For those who agreed to share their contact details, you will have access to the participant list. And you also have access to the brokerage event list of participants if you want to network to contact some of the participants who are interested in the same topic as you are, to build or join a consortium. You can also use the partner search tool of the EU Funding and Tenders portal. You have the link here. You can get in touch with your IHI national contact point. And you can, of course, also use network on social media, and you have really useful link on this slide. So that's the end of the presentation. Thank you for your attention, and we are very happy to respond to any question you may have.
Thank you very much, Usama. That was very thorough. I think very useful for those online. So as you said, you're ready to answer some questions. So let's get into it. The first one's actually on go back to the expected outcome slide. All the slides will be published very shortly on the website. So you'll be able to have access to everything that you could possibly want. So the question here, Usama, is, well, it's two questions. So let's start with the first. Is it true that only one proposal will be selected for funding in this topic? I know you covered it in the slides, but is only one proposal going to be covered?
No. So yeah, as I said during my presentation, so the IHI funding here is up to 40 million. Then we have estimated that the proposal to address all the objectives, expected outcomes, and expected impact, which are mentioned in core topic text, that should at least request between 10 and 20 million, which means that we expect at least 2 proposals to be granted, but it will depend on the funding that will be requested by the top-ranked proposal. Let's say that the 4 top-ranked proposals are all requesting 10 millions. It means that 40 millions are available. It means that 4 proposals will be granted. So there will be 4 projects. If the 2 top-ranked proposals are requesting 20 millions, it means that there will be 2 projects that will be granted and that will be launched. So no, we don't. The response to the question is no. There will not be only one proposal that will be selected for following the evaluation.
Very clear, very clear. And this is true for the other single stage topics as well.
Yes.
Yes. Okay. Thank you very much. All right. So on the next question is on the duration of the project. Is there any maximum duration for the project?
There is no maximum, but it has to be sensitive, meaning that it cannot. You have to define the the appropriate duration to address the objectives, expected outcomes, and expected impact of the project, which mean, of course, several years of duration, but not too long as well or too short. I know it's all relative, but it's really, I mean, a 10 years project would not fly. It's really too long, as well as a 1 year project is too short. So it's a difficult question to answer. But I would say there is no defined maximum or defined minimum, but you have to really carefully consider the duration, and also kind of justify if you're having a long project, I don't know, let's say 7 years or 6 years or 8 years, I don't know, to really consider the justification behind as to why you need such a duration.
Very good. So how about any indication on the readiness of the innovative technologies? So they give an example here in the question. Is technologies that are validated at the preclinical level, could they also be considered?
So that's a very good question. So as you may have seen in the draft topic text, we expect clinical studies to be conducted within the future projects, meaning that the innovative technologies that will be implemented, that will be part of the project, need to be advanced enough to be tested in a clinical setting, to receive the regulatory approval for the testing in a clinical setting. So yeah, so that's the kind of level of readiness that is needed.
Very, very good. Thank you. I think that the next question you covered it, but we'll ask it quickly. Is 40 million is the maximum budget available from the European Union to fund the proposals?
Yes.
Yeah. All right. So that's covered. The next question, I mean, I can ask it to you, Osama, but we might just bring it over to Desmond if if this is clearer. It's just a question on non-European Union countries. Are they allowed to participate in the program? If so, can they get funding?
So the response is yes, but for the details, I will ask Desmond to respond to this question.
Sure.
Can you guys hear me?
We can hear you just fine, Desmond. Absolutely.
All right, fantastic, thanks. And just my comms also are not ideal for this particular webinar. Okay, so in relation to non-EU, let me just make one point first before I jump into the funding, which is we just want to clarify that there is a distinction between who can join, who can participate, and who can actually get funding. So in terms of participation, in terms of who can actually join, the rule basically states that as long as you're a legal entity, you can actually participate in the actual program, subject to a couple of minor reservations in relation to, for instance, Russian participants. But you can participate. That's fine. This is actually clear. And you're very welcome to participate. The difficulty or perhaps the complication gets involved in whether you are eligible for funding. So for the single stage calls, basically the key point here is that if you are a legal entity from the EU or from the associated countries, or indeed from a lower middle income country, then you are eligible for funding. I think the EU and the associated countries are clear to everyone, but the list of the associated countries is online. And then for low and middle income countries, then there's what's called the Horizon Europe Program Guide, which is available online, and that has the list of the low and middle income countries. So if you fall within those groups, then as far as funding is concerned, you should qualify. Theoretically, there is also a possibility for legal entities from outside this group, again, member state, associated country, low and middle income countries, to receive funding in exceptional circumstances if they're actually bringing something unique and unusual to the actual project that can't actually be sourced by EU beneficiaries. So the key point would be that if you're coming from a non-EU country, first check to see if you're coming from a low middle income country or from an associated country. If you're not coming from either of those, then basically you're getting into a discussion with the consortium and saying, look, are we bringing something unique that could, at the evaluation stage, be considered so essential for the actual project that you could receive funding exceptionally through the from the IHI-JU.
Great, Desmond. Thanks. If you want to go, I'm going to jump ahead just because I saw something come in that's relevant before. I'm going to go back to the other questions. So no worries on that. It's just, what is the situation with the UK organizations? Is the UK regarded as an associated country?
Thanks for that. That's actually a great way to continue the question. So the situation at the moment is that, as some people on the call will know, the UK signed a agreement last year indicating an indication that they were going to proceed to association with the EU. So they would essentially become an associated country. That hasn't been followed through just yet. So strictly speaking, the UK are not yet an associated country, even though we know that they have an intention to do so. So for the purposes of Call 1 and 2, the IHI approach is that we are regarding UK participants at the moment as being A, eligible to participate, and B, being eligible to receive funding, because they would fall under associated countries if the final agreement is signed. Now, this will have to be checked when we finally get to grant agreement signature next year. So what I would say to potential UK participants and those consortia that have potential UK participants in them is, this is something you actually need to think about. You need to think about, what are the implications going to be if it turns out that the UK doesn't eventually sign an association agreement and we get to the grant signature stage and those UK participants who are in the consortium actually won't actually receive funding, because the overarching agreement hasn't been finalized between the UK and the EU. So we're maintaining, and this is not just IHI, this is the Horizon Europe framework in a larger sense. We're trying to maintain as much flexibility as possible, and we're proceeding on the basis that this is going to be resolved in the larger negotiations between, obviously the UK and the EU bloc. But there will come a point prior to grant signature when this will basically come down to the wire, and the question will be asked, are you guys an associated country? If you're not, then it's clear UK participants will still be welcome to participate, but they will not receive funding from IHI-JU.
Great, thank you, Desmond. And I will refer everyone to the rules and procedures, because Desmond gave an excellent presentation on all of the ins and outs on applying for grants, what countries are involved and how that works. And I see actually that Usama has shared it there. You can see it on the slide, rules and procedures. You can go on the QR code or the link after we share the slides. So thank you very much for the answer. Now, the next question, Usama, is on, do the proposals need to include all the diagnostic tools mentioned in the AIM? The reason they ask that is they might not be all as relevant for all the types of cancers. So the diagnostic tools. The proposals, yeah.
I'm not sure to fully understand the question. Can you repeat it?
Yeah, sure. So it's, do proposals need to include all the diagnostic tools that are mentioned in the AIM? Because they might not all be as relevant for all types of cancers, all the diagnostic tools.
So does it have to include diagnostic tools to be supportive? Yes. But does it have to involve all diagnostic tools? I'm not sure to understand what is meant by all, but of course it depends on the cancer indication. You have to adapt your strategy of combining different treatment modalities and the diagnostic tools that you are using to the indication of interest, of course. It's just that I'm not sure what is meant by all, but of course you have to adapt to the cancer indication that you have chosen.
Very good. Yeah, I think that's clear. It's on making sure that you adapt the diagnostic tools to what in fact you're trying to say. Very, very, very clear to me. The next question is on commercial aspects. So are the commercial aspects also covered by the project? I mean, this is kind of two questions, but it's commercial aspects covered by the project, and how many clinical studies phases can be covered during the project?
So there is no prescription, I mean, in the call topic text as regard to the commercialization of the solutions of the that will be developed. Neither are the number of clinical studies or the phases of clinical studies that needs to be conducted within the clinical trials. So this is something which is open. Of course, we hope that as we said in the scope that of the topic, that in expected impact, that the healthcare solutions will be integrated into the healthcare system. But this is expected impact also in the long term. It might not be during the lifetime of the project. But of course, that would be a great achievement if this would be done. And as regard to the clinical phases and the number and the type of clinical phases which are expected, it's not mentioned in the call topic.
Very good. Okay, wonderful. Thank you very much, Usama. If you want to make a comment here asking, is there any benefit to establish partnership with various European countries? If you want to speak to that.
Yes, of course there are, because first of all, we all know that cancers are treated differently from one country to another also, and also for the sake of having different approaches considered coming from different countries, also for opening, I mean, the clinical studies in different countries, having more data involved, I think would be beneficial. Yes.
Okay, thank you very much. How about on somebody's asking, please could you specify if the very expensive costs of clinical development of the new therapeutic molecules are required in this call for proposals?
Not sure to understand. So the very expensive cost of clinical trials are required?
Of clinical development of new therapeutic molecules, are they required in this call for proposals?
I think it relates also to the question that was asked earlier about the readiness of the innovative technology or treatment that will be also implemented as part of the project. So the level of readiness is that it should be ready for clinical setting. We're not here. I'm not sure what is meant by the huge cost of the development. If they are talking about the development of a molecule from the drug discovery to reaching the clinical studies, it's a very long process and costly process. But here, as I said earlier, the level of readiness of the innovative technologies to be used has to be quite advanced in order to be ready for use in a clinical setting, in a clinical study.
Okay, thank you very much, Usama. So the next question is on, mentioning, one of the goals of IHI is to promote EU companies' success on a global stage. Okay. Does that imply that although non-European Union partners are technically allowed, the question is, are you going to be at a large disadvantage if those countries make up a significant part of your consortium?
Maybe I can take a stab at that, Tom, just to start. Okay, so briefly, let me break this again into two chunks. Chunk one, which is in terms of who we actually need in the project. I would just remind everyone that strictly speaking, you need minimum 3 entities in your consortium. And of that, one of them has to be in an EU member state and the other 2 can be from associated countries. So you do need this core first. Obviously EU based, this is clear. Then when it comes to kind of the larger consortium, I think Osama, I'm sure will support this. The IHI, as we know, don't evaluate the projects. Independent experts evaluate the projects. And I think that the independent experts are basically going to be asking, how does the proposal best meet the objectives and the goals of the topic text? So in other IHI projects, we do have a large non-EU contingent. It depends, obviously, varies from topic to topic. But it's also clear that if you have a very, very large non-EU component, the chances are most of your consortium won't be able to actually receive funding from IHI-JU. So I think the best way I could say it is, I don't think by having a large non-EU component, you're automatically, prejudicing your chances in terms of succeeding at the evaluation stage and the overall success of the consortium. But I think there are practical mechanics there which suggest that if you have a large non-EU component, then obviously you will also need a significant European component as well to get the funding from the IHI-JU, and basically to make sure that the work is being done by those available beneficiaries in the EU and associated countries range.
Great, thanks, Desmond. If you want to just continue, I hope I'm not cutting off Usama if you want to add something, because of course you feel free, but I just wanted to know if you could continue with what happens if the UK signs an association agreement when the project is running. Are the UK countries then eligible for funding after all?
Okay, actually, that's interesting. So right, that question assumes a primary position, which is that the association agreement hasn't been signed. IHI, along with the larger Haiti framework, takes the decision then that UK beneficiaries are not eligible for funding. So fine. I would note actually that we did have a precedent for this under IMI2, which was obviously the organization before IHI, the predecessor organization, because we had this situation with Switzerland, where Switzerland at one stage were not eligible for funding from IHI-JU. They were funded by the Swiss government. And then after they basically signed the association agreement, then they became eligible for funding. So we have dealt with this kind of problem before. So I don't want to speak to a theoretical that I don't have any control over, but I think we can say that, I think it's fair to say that if we start from the premise that the association agreement isn't signed and UK beneficiaries are not available for funding at the start of a project, and yet somehow still joined the project, I know that there was initial discussions that the UK government could provide funding for UK entities that were joining Horizon Europe projects, and there was a website, but I don't know how fully developed those mechanisms are. But let's say that they're actually in the project is running, and then the association agreement is signed. I'm confident that the IHI office, again, as part of the larger Horizon Europe program, would have to look at that in the same way we looked at it for Swiss entities and IMI2, and at least explore the possibility that we could, via an amendment to the project, introduce funding for the UK participants, because essentially what would happen is we would need to change their classification from a legal entity in the project who is not capable of receiving funding to theoretically a legal entity in the project who would be capable of receiving funding. So I can't give a definitive answer because, I mean, that comes down to questions of policy. But what I would say is we have had situations like that before, and we did amend the ability of the Swiss beneficiaries to receive funding afterwards.
Great, thanks, Desmond. And I can give it back to Osama here, or to continue with Desmond. It doesn't really matter. It's the question on which we've seen quite often, which is, can SMEs be the only private partner in the application? And if so, would the in-kind costs be refundable?
I don't want to jump in front of Osama. Osama, do you want to start this, or will I go into private members?
Please do Desmond.
Sorry. All right. So simply put, the problem with just having an SME as your private component is that it is and Osama's mentioned this and went into quite a lot of detail in the slide. It is an absolutely incontrovertible, unmovable condition we have that applicant consortia preparing their proposals must be able to contribute this 45% in kind. And by definition, that 45% in-kind contribution has to come from the private members of IHI and their constituent and affiliated entities and the contributing partners. So an SME isn't going to fall under that classification. An SME obviously is going to bring usually super valuable IP to the actual project, and they're going to bring a certain entrepreneurial productivity, which is great, but they can't actually meet that hard rule which is there. So what we've basically been doing is, and Catherine and Tom did a lot of this at the brokerage event, we've basically been encouraging SMEs to actually get involved with the other traditionally industry members, such as the private members, such as the large organizations, and discuss how they can get involved with consortia. But a one-line answer is no. An SME isn't going to be enough for your proposal with a bunch of what we would call public bodies for the applicant consortia, because you're not going to be able to meet the 45% rule.
Maybe just for the sake of clarification, Desmond,
yeah.
You can respond also. It's a question from me too. Is that I think that an SME can also apply to become a contributing partner, so it could bring some kind of, if they become contributing partners, they could bring a proportion of the in-kind contribution. Can they?
It's conceivable, and we've gained this, but it's unlikely. It's unlikely based on the amounts involved that the SME would then make the application to become the contributing partner. The contributing partner would then be responsible for the full 45%. Let's say it's theoretically, numerically possible, but based on the amounts in the call topics and then the amounts of the proposals, it's unlikely. But we don't want to completely rule it out. But I would find that a very, very unusual edge case if that was suggested.
Okay, well, thank you very much for the point. Probably get lots of disclaimers, but SMEs generally are eligible to receive funding.
Yeah, very much so.
Right. So the next question, I'm going to go to Usama on this one for sure. Is nuclear medicine included in this call?
Yes, it is. There is a list of the different therapies that is also part of the call topic text. And yeah, of course, nuclear medicine is part of the scope of the call.
Very clear. Thank you. And do you have an idea of the expected start and the whole duration of projects? You kind of covered this a little bit, but you want to make any comment on the expected start and the duration of the projects quickly?
So I can say about the expected start. It will for sure be so the start of the projects, because we expect to have at least 2 projects to be granted, would be so in 2023. So it could be early 2023, the start, or maybe in the second quarter of 2023. For the duration, so it relates to the question that was asked before. So it will depend on each proposal and the duration of the project they are requesting, which should be aligned with the project activities, and also to ensure that they comply with the requirements of the call topic.
Great. Well, thank you very much. And the next question is, at the risk of, again, that we have a rules and procedures webinar, but the question is, can in-kind contribution of personnel cost be part of the 45% in-kind budget?
I mean, I think it will be, but only for, as we said, private members. So the private members are going to be contributing this. And when I say private members, again, just to re-emphasize, we're talking about essentially FPA, COSIR, Buy Europa, MedTech, and their constituent and affiliated entities are going to be contributing this. So for the purposes of everyone on the call, and we said this in the brokerage event, in the legal presentation in the brokerage event, and we said it a lot in the rules and procedures webinar that Tom's referred to a few times. Because we're talking about a single stage call here, the private members are going to supply this 45%. So strictly speaking, it's their responsibility, but everyone in the actual consortium should be thinking about it and aware of it, and you should be able to have this discussion to make sure, because as Osama said, this is a hard, no negotiation eligibility condition. Either you hit the 45% and you're eligible, or you don't. So this is something that does actually need to be considered, and it's, there's a very frank discussion should be had with the private members very early. I can confirm that they are aware of it, but I don't think it's ever too early to actually start this conversation. That's one point. And then on the second point, just before, in case we don't mention it, there is a few documents online which we would strongly recommend anyone on the call who's getting involved in a application should look at. The first one is the IHI Guide for Applicants. Now, this is in its final stages of preparation, and it's going to go online either tomorrow or early next week. Just check the website for it, and it literally opens everything up for potential applicants right from the very start, from reading the call topic text through to preparing your proposals, through evaluation. It talks about the 45%, it talks about in-kind, it talks about contributing partners, and it will be an extremely useful guide for everyone on the call. And most importantly, it's not too technical and it's not too long. So I would unreservedly recommend that. The legal team, we were debugging it last night and we think it actually reads quite well now. The second document is also online. It's longer and it's more concerned with if you get through the actual proposal and evaluation stage and you start preparing a grant, but then the annotated model grant agreement, the Horizon Europe annotated model grant agreement, it's available online. The current working version dates from November 30th, 2021. It's definitely online because we checked for the rules and procedures webinar. And if you have that and the guide for applicants and the call topic text and the additional links and that the team has put in here in the slides, you'll be well prepared. And then lastly, if there's something exceptional, an additional question which you need clarification on, please use the info desk facility. The legal team, we feed into it and we address the questions that come through, and it's a functional mailbox and you can usually respond quite quickly. So I think between those resources, I think most of the questions that could come up would be addressed quite readily.
Thank you very much, Desmond. The next question I'm going to throw over to Usama. It's is this the focus of the call on phase 1 clinical trials? So is there any preference on certain cancer types, related to their frequency or their survival rates? So that's the question.
Yeah, thank you, Tom. No, so you will see it. You can see it already in the draft topic text, and you will see it in the final topic text. There is no prescription of or any indication, cancer indication. So it's open to any kind of cancer indication, even rare cancers. And I said also earlier, for the clinical phases, there is no also indication in the clinical phase.
Great. Well, thank you very much. I do not see any other questions at the moment, so you can get typing very quickly. If not, I do want to thank everybody for coming out and listening to this very informative webinar. Obviously, to Usama for presenting, Desmond for helping to answer questions, Catherine on the technical side, and the finance team that gives all this information behind us. So thank you to everyone. Thank you for coming. Remember that you can write to us at InfoDesk, like Desmond had said. You can check our website for the recordings, the participant lists. What am I missing? The slides, of course. Some of you have asked for the slides. They will all be on our website. And if there's anything else, you can contact us and we will get back to you. So thank you very much. Thank you to Usama, Desmond, and
Thank you.
I wish you all a wonderful day.